Welcome, everyone. We are so excited to have you join us for our virtual STEM Goes Red event. My name is Ani Snyder, and I'm the Regional Vice President for the American Heart Association in Eastern Iowa. We're fortunate to partner with our presenting sponsor, TCS Consultancy Services, to bring this unique opportunity right to your homes. We're also thankful for our other supporters, Collins Aerospace, International Paper, Schneider Electric, and Quaker Oats for making this possible. Now I have the extreme pleasure of introducing you to our keynote speaker, Dr. Sharon Beth Larsen. Dr. Larsen is a clinical assistant, professor of surgery, and a cardiothoracic surgeon with the University of Iowa Healthcare. Dr. Larsen is a leader in her field and the first female cardiothoracic surgeon to practice in the state of Iowa.
Good morning. I'm Dr. Sharon Larsen. I'm a cardiac surgeon at the University of Iowa Hospitals and Clinics. One moment. We, of course, are one of the sites that are engaged in combating the COVID-19 pandemic. So our protective gear is very important for our patients' health and for the healthcare workers' health. Thank you for this opportunity to speak with you today. And thank you for being flexible and allowing us the opportunity to do this remotely, to keep everyone safe, but still gain the benefit of this time together to talk about the really important careers that you're considering in science, technology, engineering, and mathematics. Let's proceed to talking about those areas: science, technology, engineering, and mathematics. There is very little in our lives that is not touched by these professions. And certainly in today's climate, every aspect of STEM, science, technology, engineering, and mathematics, is helping us to combat the enemy that is COVID-19. First, we'll consider the scientists that are engaged and how very few of them are women. So women and minorities comprise 70% of college students, but less than 45% of STEM degrees. Women remain underrepresented in the STEM workforce, representing just 29% of STEM careers. And so it's for this reason that we're all here today, because the University of Iowa Healthcare STEM education wants to reach out to you young women to encourage you to explore and pursue STEM careers and develop the critical thinking and problem-solving skills necessary to take STEM to the next level. Now, this time can be very scary, full of fear. And this pandemic has brought out some of the worst, but certainly some of the best in all of us right now. I'm so proud of our community for pulling together and taking the steps necessary to socially distance to protect the health and the life of all of us. We're all in this together. And here at the University of Iowa, we stand together. One thing that has got me through is to remember this quote from Mr. Rogers, an influential person from my childhood growing up. He would say when he was a boy and he would see scary things in the news, like we're all seeing today, his mother would say to him, "Look for the helpers. You will always find people who are helping." And we are certainly part of those helpers in combating COVID-19. All the healthcare workers in this hospital, the doctors, the nurses, the nurse practitioners, the physician assistants, everyone inside this hospital is combating this enemy of COVID-19, and those helpers are readily available. There are other helpers in combating COVID-19, and it is those individuals who've dedicated their life to a career in STEM who are going to help us see this through. When we consider the science behind the COVID-19 pandemic. We see a lot of hope coming from those individuals who have dedicated their lives to a career in science. These scientists are going to develop and distribute a vaccine that will help protect us from infection of this virus. Science has changed a lot in this pandemic in that there is a tremendous amount of collaboration where the singular goal is combating this pandemic. And it is encouraging to see the brightest minds collaborating and working together for this singular goal of combating COVID-19. So we see how that first element of STEM, science, has a major role in today's pandemic. Then we turn to technology. And first we think about the technology that's used to combat this pandemic. There's digital technology that's helped us to respond to this pandemic. And it's often technology has had a history of helping the medical industry track and to treat viruses. It's helping us to test, to track the number of cases, and to treat these individuals who have been plagued with COVID-19. Technology has also had an unprecedented demand during this pandemic to determine the successful solutions for screening our population, tracking the infection, prioritizing the use and allocation of resources like personal protective equipment, and designing targeted responses. So we see again that the technology portion of STEM has a direct role in the involvement in this COVID-19 pandemic. We also see how in our personal life, technology has become so necessary to continue those activities that we are separated from because of social distancing during this pandemic. So for educators and information technology administrators, they've been using technology to engage students through distance learning. So we can still engage in our educational activities in a non-traditional classroom setting. E-learning has become the new standard for students and for teachers during this pandemic. And without the technology to carry that through, we would be lost. It's also important to stay in touch with our family and friends that we're separated from in our commitment to social distancing to stop the spread of this pandemic. Remote conferencing is inspiring technology for good, bringing us together to keep in touch and keep our spirits up. And the greatest minds in technology are accelerating the development of these platforms for communication because we see that we're in this for the long haul and we don't want to be separated from those that bring us so much joy and inspiration in communicating with them. So technology, both on a pandemic level and on a communication level, is imperative to see us through this time. Then we look at engineering. As the coronavirus is continuing to spread, there are researchers who are providing engineering solutions to ensure that there are adequate supplies for the people who are on the front lines treating patients with COVID-19 and other patients as well. There's antiviral engineered approaches to help defeat the virus. And specifically, engineers at Apple recently developed an adjustable face shield, very similar to the one that I had on at the start of the program, to protect us healthcare workers on the front lines of the coronavirus pandemic. There are many ways that engineers with hardware, software, web development skills can help, from collaborating with academics to building tools for small business owners during this pandemic, so that we can carry on as much of those activities of daily living that we were accustomed to before this pandemic in a new platform. Those engineers are essential to seeing us through. And mathematics. We've all heard about flattening the curve. Well, that curve is derived from mathematics. The chances are that if you ask during this pandemic, why is that so? Or I wonder what would happen if we tried this treatment. There is a mathematician somewhere who's tried to incorporate the descriptive equations into a model to answer that question. Math is helping with this COVID-19 pandemic and other catastrophes worldwide and throughout history. And there's even the mathematics of life and death and how these disease models that mathematicians are developing help shape our national shutdowns and other pandemic policies so necessary to keep us all safe. So from science, technology, engineering, and mathematics, those careers and those individuals who fill those careers are going to help see us through this pandemic. Now, the COVID-19 pandemic has received a tremendous amount of our attention right now. And there are other things that are threatening our livelihood. COVID-19 cases in the United States as of April 21st, 2020, the total number of cases reached 776,093 individuals. And unfortunately, the number of deaths in the United States due to COVID-19 as of April 21st, 2020, reached 41,758. These are staggering numbers. And quite sadly, they are expected to rise. But there is another enemy that is threatening our health and our life. And we can see that that is in heart disease. When we look at the number of cases in the United States of heart disease for this year, if we consider the number of patients who are diagnosed with cardiovascular disease per year, while there is some range from year to year, that is approximately 35,300,000 patients in a year who will have cardiovascular disease. We will not reach that number of patients diagnosed with COVID-19. Heart disease deaths in the United States per year is approximately 647,000. With the appropriate mitigation efforts for COVID-19, we should not expect to see that number of deaths in the United States. Yet here, heart disease or cardiovascular disease is our number one enemy. And it's not getting as much attention as COVID-19 is right now because of the exponential number of cases and deaths that COVID-19 is seeing. But we know that heart disease is the number one threat to our lives. So we know that the helpers in COVID-19 are those scientists, technologists, engineers, and mathematicians. And in heart disease, one of our greatest helpers is the American Heart Association. This is an organization dedicated to eliminating, certainly reducing the amount of heart disease and the number of heart disease deaths that are occurring in America. And through their initiative, the Go Red for Women initiative, they are combating the number one killer of women, which is heart disease. As it is the number one killer of women, and we know that 44 million women in the US are affected by cardiovascular disease, this is a far greater threat than COVID-19. We are in the fight of our lives when it comes to being female, and heart disease is the enemy that's attacking us. Heart disease causes 1 in 3 women's deaths each year, killing approximately 1 woman every minute. 90% of women have 1 or more risk factors for developing heart disease. And since 1984, more women than men have died each year from heart disease. And that gap between the number of men and women surviving continues to widen. The symptoms of heart disease can be different in women versus men, and unfortunately are often misunderstood. Now, while 1 in 31 American women dies from breast cancer, another disease that gets a lot of attention, it is 1 in 3 women that dies of heart disease. So prevention is key when it comes to the number one threat to women's lives. Studies show that healthy choices have resulted in 330 fewer women dying from heart disease per day. So what are those healthy choices we can make? Don't smoke. If you do smoke, quit. If you don't smoke, never start. Manage your blood sugar. Get your blood pressure under control. Lower your cholesterol. Know your family history. Lose or manage weight and eat healthy. And utilize partners like the American Heart Association and your physicians to understand your risk factors and to combat those, to give yourself the greatest chance of combating the number one threat to your life. Now, the American Heart Association Go Red for Women initiative has had a tremendous impact in being that helper when it comes to women's lives and combating heart disease. The Go Red for Women initiative has led to nearly 90% of women making at least one healthy behavior change because of the influence that Go Red for Women initiative has had on them and what they've learned from that initiative. More than a third of the women who participated in Go Red for Women events have lost weight. More than 50% of women have increased their exercise. 6 out of 10 women have changed their diets. More than 40% of women have checked their cholesterol levels. And a third of women have talked with their doctors about developing heart health plans. Today, as I said earlier, nearly 300 fewer women die from heart disease and stroke each day because of those preventative measures that the Go Red for Women and American Heart Association initiative has allowed these women to do. Death in women has decreased by more than 30% over the past 10 years. Now, there are other helpers aligned with the American Heart Association in combating the number one threat to women's lives. And a lot of those individuals, those helpers, come from STEM careers. Cardiovascular disease technology will have a market that will exceed 40 billion in just 10 years. Mathematical challenges in cardiac electrophysiology is being reported. Tissue engineering of heart valves has allowed us to advance the treatment of valvular heart disease. Scientists have found ways that obesity directly damages the arteries and contributes to heart disease, and then leading to discoveries that could eventually lead to new treatments. And there are mathematical models that help reproduce the patterns of tachycardia, a heart arrhythmia. So we see again those helpers in combating the enemy of heart disease are coming from the STEM careers in science, technology, engineering, and mathematics. Now, I chose a career in STEM, in healthcare. I had a love of cardiothoracic surgery from a very early age. And this STEM career did not start because of an initiative for the Go Red for STEM event that we're participating in today. But boy, I would have been the first one signed up had there been that opportunity. I've always wanted to be a cardiothoracic surgeon. And certainly, as many of the helpers we see today combating COVID-19 and heart disease, it was out of a great desire to help another individual maintain their quality of life, improve their quality of life, and save their life. So in my career in STEM, there are some key elements that have gotten me through, that have been required, and I'll share those with you to help navigate that path to a career in STEM. And the first is passion. Passion is important when it comes to achieving your dreams. When we work really hard for something we don't care about, that's stress. But when we work hard for something we love, that's passion. And those things that you are passionate about are not random. It represents your calling. For me, it reminds me why I was put on this earth, why I was born, to do heart surgery. That is my passion. This passion was illustrated very early on. In second grade, many of my friends had wanted the Barbie dream house for Christmas. And I wouldn't have mind getting that as a gift as well. But for me, it was a model heart that I really wanted to get when I was in second grade. So this desire to have a career in STEM, in healthcare, in cardiothoracic surgery, started at a very early age. I had that passion early on. That passion had to be strong enough to see me through decades of school, training, residency, and work. It's been difficult. But every great dream begins with a dreamer. It begins with you. Always remember that you have within you the strength, the patience, and the passion to reach for the stars, to change the world, to be that helper. Those are beautiful words of Harriet Tubman. And Mark Twain is famously noted for saying that the two most important days in your life are the day you are born and the day you found out why. The American Heart Association asks, what is your why? Why do you take care of your heart health? Is it because of your family? Is it because you take care of patients and you want to see them live their full potential? So hold on to that passion. Maybe it will be discovered later on, but that the fact that you are participating in this event, STEM Goes Red, shows that somewhere within you is a great passion to help and pursue a career in science, technology, engineering, or mathematics. Now, with every good career comes prerequisites, the academics, the learning, the diligence that is required to achieve your goal. So a lot of the STEM majors would include things like astronomy, biology, chemistry, computer science, engineering, earth sciences, health sciences, information technology, mathematics, and physics. Now, these majors in college are required to likely go on to additional education or to prepare you for a career. So there are courses that are going to be required, and you have to get through them before you move on to the next step. And that's okay. You're up for that challenge. But it's important to understand the journey that you'll be navigating through as you reach that STEM career. Now, for me, it was a career in science and healthcare, and that meant going to medical school, which meant that in college, I had to take a certain number of prerequisite courses to gain entrance into medical school. And those admission requirements will vary from school to school. For me, I had to take the medical college admission test, which is common for all students applying to medical school. And at a minimum, you'll likely complete the following types of courses: a year of biology, a year of physics, a year of English, and 2 years of chemistry that goes through at least organic chemistry. Now, while I can't say that on a daily basis I utilize organic chemistry in heart surgery, nearly everything I do, especially the medications I utilize, are based on that organic chemistry. And that fundamental understanding is important to carry me through in the activities of my STEM career. Now, the courses you take are going to be very important to meet those requirements to show that you have the knowledge to carry you through a career in STEM. But what connects you, what keeps you going, are those unique qualities that make you you. And a lot of that has to do with how you spend your pastime. So that can be volunteering, and the knowledge you gain in helping to take care of patients in a nursing home setting or in a hospital. Traveling can allow you to come up with unique experiences that will allow you to bond with a patient over a shared travel experience. Whether it's marching band and you're the drum major and develop leadership skills, that will take you very far in a career in STEM, or learning to work as a team member. If one member of a marching band is out of line, the whole formation is ruined. And so there are skills that you'll develop in your pastimes that are going to be very important to the development of a successful career in STEM. So do not make those a second priority. Make them a high priority along with your prerequisites. Charlie Chaplin said that we think too much and feel too little. More than machinery, we need humanity. More than cleverness, we need kindness and gentleness. Without these qualities, life will be violent and all will be lost. I did not learn a lot about the expression of kindness or gentleness in organic chemistry. But through my pastimes, playing soccer and being in the marching band, working with other people, helping to support them in their weakness and celebrating them in their strength allowed me to develop skills that I can connect with people in my career in STEM. Practice. We've all heard that practice makes perfect. Now they say that amateurs practice until they get it right, but professionals practice until they can't get it wrong. I remember wanting to participate in my first heart surgery to actually throw a stitch. But there's a lot to throwing a stitch. It's not just how to handle the needle driver, how to handle the needle, but once the stitch is through, you have to tie it, and you have to be proficient at tying those knots. They cannot come undone. And so I practiced and practiced, tying a string around anything I could find and going through the motions of tying those knots over and over and over again until it became second nature, where I didn't have to think about it. And it was that practicing of throwing each and every knot and learning new skills and practicing them over many, many years that have allowed me to get to the point where now I'm performing open heart surgery on adults on a daily basis. So remember, when you're in that practice, it may seem tedious at times, but it's necessary to get you where you want to be successful in your STEM career. Remind yourself, today I will do what others won't so that tomorrow I can do what others can't. There's a very famous author, Malcolm Gladwell, who wrote a book called Outliers. When we consider practice, the difference between ordinary and extraordinary is practice. So in his 2008 book, Malcolm Gladwell wrote that 10,000 hours is the magic number of greatness. I don't know that I've spent 10,000 hours tying knots, but I've certainly spent at least 10,000 hours developing my skills, connecting with other human beings to become the heart surgeon that I am today. Based on studies in elite performance, Gladwell contended that it's an extraordinarily consistent answer in an incredible number of fields, especially the STEM fields. You need to have practice to have apprentice for 10,000 hours before you get good. Remember to practice. And perseverance. When I was in second grade and asked for that heart model instead of the Barbie dream house, never could I have imagined the success that I would see one day by having that passion, by practicing, by engaging in my pastimes and fulfilling my prerequisites, that one day I would be the first cardiothoracic surgeon, the first female cardiothoracic surgeon in the state of Iowa. And I'd become the leader, the surgical director of the extracorporeal membrane oxygenation program here at the University of Iowa Hospitals and Clinics. There were many tough days. There were many days where I wondered, why am I doing this? I was reminded of my why. I was reminded of my passion. And because I persevered and continued to focus on that journey in my career in STEM, I'm able to see the success today of being a leader, both in cardiothoracic surgery and for other young females aspiring in a career in medicine as well. Winston Churchill is famously known for a lot of reasons, but one of my favorite quotes from him is never, never, never give up. Unfortunately, there were people who did discourage me or found it necessary for them to try and limit my success. But I never gave up. And I encourage you to hold tight to your passion and never give up if a career in STEM is what you wish to pursue. Success is the sum of small efforts repeated day in and day out. It does not matter how slowly you go, so long as you do not stop. It always seems impossible until it's done. Success is not final. Failure is not fatal. It is the courage to continue that counts. I am so honored to have the opportunity to speak with you today about your careers in STEM, your career aspiration in STEM, about the influence that the American Heart Association is having in protecting and saving the lives of women against the number one threat to their lives, heart disease. To talk to you about the ways that those individuals in STEM careers are the helpers today. I encourage you to help one another. Become those helpers. Each one of you is a rare and beautiful gift to this world, and your skill set is going to help this world be a better place. Thank you so much. Have a great day.